I wanted to talk about sleep apnea because it's not just about snoring. It is a silent stress test on your heart every single night. Now, I know I'm going to get a little bit more technical, but I'm going to try to keep it nice and simple as I always try to do when I do my videos. But, anyways, I'm going to give it a try. So, sleep apnea, what's happening when that happens? So, this is when someone actually, what does it mean? This is when someone has been diagnosed of when they're sleeping, they stop breathing for a period of time. So, obviously, when they stop breathing, the oxygen level also drops. So, when that happens, the brain immediately senses the lack of oxygen and then it sends out an alarm. It's like, oh my gosh, we need oxygen now. So, this is through your central nervous system. What happens next? So, once the alarm is switched on, the sympathetic nervous system kicks in. This is your body's fight or flight response, right? And then it's going to send hormones like adrenaline and cortisol. They will be released into your bloodstream. Now, the adrenaline is going to lock into the beta 1 receptors of your heart. Maybe I'll talk about that some other time, but, anyways, just take my word for it. So, the adrenaline is going to lock to the beta 1 receptors in the heart, and it will forcing the heart rate up and making the chest gasp for air. This is when, like during the night, your spouse might go all of a sudden, and then their heart is racing. Well, this is the sympathetic response, all right, to the lack of oxygen. So over time, that repeated surge puts enormous strain on the heart. So cortisol, on the other hand, this is a hormone that fuels the inflammation inside the blood vessels, which will contribute to a much higher blood pressure. It will also create stiff arteries and obviously increase the cardiovascular risk. So, this nightly cycle, oxygen drops, stress hormone rises, heart rate spikes, the vessel inflames. This is why untreated sleep apnea is totally linked to hypertension, arrhythmias, heart attacks, and stroke. So if you do have a CPAP machine sitting in a closet, please dust it off and use it. It's not just about better sleep, it's about protecting your heart and your life. So I hope it was explained like not too technically and it still makes sense. And I know you got this. Till the next one. Tolu.